Hello everybody. I saw a patient the other day whose hip I replaced a year ago. When I called her into my office, she shot out of her chair with a huge smile on her face. I love it when this happens because I know that this is a happy patient, and of course I love happy patients. We talked about her recovery and what she'd been doing since she'd had surgery. Everything, she said. The surgery was life-changing. She had a particularly bad hip and a few issues that significantly increased the risks of surgery. She told me that the reason she'd chosen me to do her surgery was because she had seen some of my videos and she liked the way that I discussed complicated hip problems. As she went on her way with a spring in her step, I reflected on what she'd told me. When I was at the beginning of my career, I was quite gung-ho and I took on cases that nobody else wanted to do. After all, that was my job. What could possibly go wrong? Well, actually, quite a lot. I quickly realised that I couldn't fix everything that came my way and expect a perfect outcome. Dealing with complications is a major part of being a surgeon. It's often the most difficult as well. You have to confront and deal with not only the patient's fear and disappointment, but also your own feelings of failure and despondency. But you learn from these problems, mostly things about yourself, how you make decisions, and how you communicate with your patients. It's hard and lonely at times. So what does this have to do with the patient I saw the other day? Well, when she came to see me, she was in terrible pain and desperate for help. I could have told her that it was too risky to have surgery, but that would have sentenced her to many more months of misery and failing health. It would have made my life easier. After all, you don't want to make it more difficult by taking on tricky cases that have a high risk of complications. But if someone like me, with years of experience, couldn't help her, what then? Well, we looked each other in the eye and discussed all of the risks and benefits and the treatment options. We agreed that surgery was the only thing that would give her a chance of getting her life back. It could have gone horribly wrong, but it didn't. And isn't that wonderful? If you'd like to know more about how I could help you, or if you've got questions or comments, then please get in touch. The details are below. Thanks for watching. See you next time.